These books Good evening, everyone.
Good evening.
I'm not going to try it again. It might not get much better. As everyone knows, it is customary for this board to begin our meetings with a prayer by a sitting commissioner. During this time, you're welcome to stand and join us in that prayer. You're welcome to use it for your own prayer or a moment of silence, whatever may be on your heart today. And then after the prayer, we'll have a pledge of allegiance that will be led by Commissioner Outlaw. And at this time, I'd like to call on Commissioner Sue Leggett for the invocation. Commissioner Leggett.
Let us pray. Dear Lord, as we gather together today as representatives of Nash County, we're especially thankful for the bountiful blessings that you provide to us each and every day. We pray for those who need your healing hand and your reassurance. Please be with us as we conduct the business of Nash County, that you may guide and lead us to do what is right and good in your sight and will. These things we ask in your precious and holy name. Amen.
Amen. Amen. Would you join us in the pledge? I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, Commissioners. At this time, we are on item number 4. And item number 4 falls in line with our second meeting of the month, which is to hear from our outside agencies. And this month, we have Dr. Lee Isley with our hospital. And I would call on Lee at this time and let him introduce anyone he may have with us. Good evening, sir.
Good afternoon, sir. Thank you for allowing us to speak. I've got Jason Brand, Vice President of Support Services, and he will share with us a little bit about the inpatient tower as we get further into the presentation. So want to also recognize the Board of Commissioners for the hospital that are here with us, Mr. Kenneth Arrington, who is the Vice Chair, and Mr. Bill Lanus, who is the immediate past chair of the NHCS Board of Commissioners, and so I want to recognize them as well. As we start today, I appreciate the opportunity to share with you and update you on our strategic plan as well as our master facility plan and the operations of the hospital. And so we do this periodically, so for the most part this will be an update. Please, as you have questions, just ask and we're glad to give you further information. So the last time we were with you, we walked you through our new strategic plan, which was approved by our Board of Commissioners in the spring of 2023. And this plan is put together by going out into the community, working with our physicians, our board, our religious leaders in our area, and our staff and leaders to talk about what we need to do over the next 4 years to be successful for our community and our patients. And so I'd call your attention to the 4 strategic imperatives. They're in the red box there, and we'll talk about each one of those very briefly, high level. Workforce engagement is where we'll become a healthcare employer of choice, where employees and providers are engaged and empowered to provide outstanding care to patients and families, just as all industries have been impacted by labor shortages. Healthcare is no exception to that, and we want to make sure that we continue to be a good place to work to ensure that we have the staff for our patients and community. Safety, quality, and service, where we elevate our position in the region as the leader in quality and patient experience, improving the overall health of the community. Under specialty services, that's where we deepen and broaden the medical services we provide that best meet the growing needs of our region. And then ease of access, where we make it easier for patients, providers, employers to access and navigate our service. I do want to mention briefly that our strategic plan complements that of UNC Health's. We're engaged in their strategic plan just as they are engaged in ours. Just remind the board that we are an affiliate of UNC Health System, which means that we are under a management agreement and that we are not owned by UNC Health. We have our own local board of commissioners. With your help, we just increased that to 15 individuals who all live and work in our community. They have the local fiduciary and strategic responsibility for Nash healthcare systems. Our relationship with UNC brings lots of resources and benefits to our local community through their expertise and breadth of services, but we pay for those services through that relationship, and I'll walk you through a few key updates within each of these strategic pillars. So under workforce engagement, as many employers realized this past winter, we were falling behind, making it more difficult to hire and retain staff. We brought in an outside consultant. We did a market competitive comparison, and through the leadership of our board and working in conjunction with our board, we increased our salaries and compensation to the tune of about $4 million. That impacted about 85% of our staff, and we do this every 2 years. Now, obviously, this first one was a larger financial commitment and investment, and as we go about this every other year, we should expect that that investment gets smaller because the market should move less in that time period. Again, for under safety, quality, and service, two areas I want to point out. One, I want to thank our board for its vision and persistence in improving our quality of care. I know over the last 6 years that we've been together, we've had lots of conversations about that, and you guys have been very supportive as we've continued to improve our level of care and service offerings. It has allowed us to achieve some top national and state awards and recognition. One of those reasons that we've been successful is that we have a highly engaged Quality Leadership Council. That is the quality committee led by the board, and the chair of that is Dr. Mike Johnson. You guys are very familiar with Dr. Johnson, and he has done an excellent job for us in keeping us on task. The other one I want to point out and explain to you a little bit is about dyads and triads. So we believe very strongly in these. This is just simply where we bring a clinical leader or an administrative leader in the hospital together with a physician or physician leaders, and they work on improvements and quality goals. We have a couple of examples up there for you of the dyads and how they've been working and some of the things they've been working on. We now have 27 of these dyads throughout the hospital and have been seeing tremendous amounts of improvement. Matter of fact, one of our major successes since we've put these dyads in place is that we've seen a 41% reduction in our infections year over year. And it really is, we contribute because of this leadership. A triad is just simply we take the physician and that clinical leader and we put a person in the quality department with them to help them work on their projects. So that's what a triad is. The other that we're very proud of that the board has been committed to is working on social determinants of health. Those are just simply those barriers or social issues that impact our patients and our community's ability to stay healthy. We screen every patient upon admission to the hospital on social determinants of health. And so examples of those are financial strain, food insecurity, transportation barriers, unsafe housing, medication access. And thanks to the generous donation from our staff, the medical staff and the community, the UNC Health Foundation, UNC Health Nash Foundation, is able to provide customized support to our patients. So these are services that we don't get reimbursed for, but we don't have to expend dollars for these through our operations. The support comes from the Nash Foundation. And some of these are the inpatient food pantry that we've put in place, the community paramedic program, and then patient assistance, which could include medication, home safety, modifications, and all of these services, again, are donated through and paid by the Nash Foundation. All of this also reduces the cost of health care as we are monitored and penalized by Medicare, Medicaid, which we call CMS, for patients that get readmitted back to the emergency department or into the hospital within 30 days. So we get penalized for that. We've been able to reduce that significantly through these efforts. We have a number of partnerships throughout Nash County, and certainly appreciate the collaboration with you through EMS, the health department, social services, just to name a few. So lots of good partnerships that are allowing us to broaden our reach in our community. And then specialty services, we continue to recruit providers who are excited to work and live in this community. We've not only heard from you, but our board has said that we should recruit physicians to live in our community, not just work. And we hope that you see them around. They're involved and engaged in lots of activities. They're raising their children here, and we are certainly a stronger community for that. We determine which providers we're going to recruit through a provider needs assessment, where we work with an outside agency. There's some formulas that we use on how many physicians per population you should have in that specialty, and that helps us determine how we should recruit. And then ease of access, and Jason's going to talk to you a little bit about the master facility plan, but I want to point out that we're also, as I've shared with you, only 50% of our patients that we serve come from Nash County. And then through this strategic plan, we have started this last year broadening our footprint and reaching out and speaking with smaller hospitals that need assistance. And they have been transferring their patients to Nash. We've found a niche. We're not tertiary and we're not quaternary, but we offer some services that smaller hospitals in eastern North Carolina aren't available to. And it's got 3 prominent benefits to our hospital here. So one, it allows us to recruit additional specialties that we otherwise, without receiving patients from outside the region, would not be able to recruit, because our volume of those procedures just wouldn't be high enough to either attract or keep those physicians competent. And the greatest example is GI. So GI physicians, gastroenterologists, have what we call advanced GI and regular GI. The advanced GI do procedures called ERCPs and some other advanced procedures that if we did not receive patients from outside Nash County, we just simply would not have the volume to be able to recruit those physicians. But because of that, we're able to recruit those, and we have those physicians here available for our citizens here in Nash County because other hospitals are helping us with the volume for that. Number 2, we're receiving additional revenue. Sean Hartley, the Chief Financial Officer, which you've heard from in past updates, who is with us today, continuously keeps me and the team abreast of how we're doing from a revenue standpoint, and we're actually receiving good reimbursement and additional revenue that we otherwise wouldn't be receiving, and then we can reinvest that here in our community for us in Nash County and surrounding areas. The third is that we're able to work with our tertiary and quaternary facilities like ECU in Greenville, UNC in Chapel Hill, Rex in Raleigh, and we're actually able to free up beds that these patients would be going into those medical facilities and taking up those beds, and we would have trouble getting our sickest patients into those facilities because the patients that coming from the region. So we're able to free up those beds, and I've worked with Dr. Ann Schreiner, who's our Chief Medical Officer, and we're seeing it being easier for us to get patients into those facilities because of the partnership that we're seeing here. And so those are the three distinct results of us broadening our footprint, and I'm very proud of the staff and the medical staff for stepping up for that. I'm sorry. Oops. We are also, as Jason's going to talk to you mostly about the inpatient tower here at the hospital, I want to let you know also, as part of the master facility plan, we plan to break ground in the next year on 2 new medical office buildings, one in Nashville and one in Middlesex. The one in Middlesex will be located on our campus that we already have there. It's adjacent to your park. And it's to meet those growing needs in primary care and specialty cares. And so we're starting to rotate specialists out to Middlesex. We're continuing to recruit primary care for Middlesex, and we'll do the same in Nashville. And of course, the tower project, and Jason's going to talk to you a little bit about the tower project, and we'll be glad to answer any questions for you.
Thank you, Dr. Isley. The tower architectural and engineering team is currently wrapping up the design development phase and beginning to move into construction documents at this time. This slide shows a typical patient floor with 30 rooms located along the perimeter with a center core for support functions, as well as our nursing stations. There will be 5 finished patient floors in the new patient tower for a total of 150 rooms. So when completing our campus master facility plan and tower feasibility studies, our clinical teams reviewed best practices and current design standards for inpatient care areas. The current patient tower, being completed in 1971, did not allow for this modern approach to healthcare service provision. The cross-shaped design limited the structural feasibilities of renovation, and whereas our current patient rooms are around 170 square feet and do not have individual showers, our new design increases that square footage to 285 with dedicated clinical and family areas. This rendering shows our typical patient room with the new bathroom to the left of the picture where the door is. There is a dedicated seating area for patient families to the left of the bed, as well as much improved space for our clinical team members to work from on the right. This is a rendering of one of our nurses' stations. The layout provides excellent sight lines to patient rooms for increased safety and visibility, and also the visitor elevators will be located on the right side of this picture. The next slide shows the exterior shell of the patient tower. So you can see the current tower is visible in the background with the parking deck in the forefront. And then the new tower, represented by the dark blue rectangle, will be positioned to the south between the parking deck on the left and Nash General Surgery on the right. So UNC Health Nash began this process over 4 years ago, which leads us to where we are today. Site enabling, which includes initial infrastructure work, is scheduled to begin this September, with primary construction scheduled for late spring, early summer of next year. Allowing for a 24-month build time, we are projecting a summer 2027 opening date. And with that, I would be happy to answer any questions or any questions for Dr. Isley.
With that, Mr. Chairman, that concludes our presentation. Be glad to answer any questions.
All right, thank you. Very interesting. Commissioners, questions or comments?
Mr.
Well, I
Chairman.
just see it as a big challenge, and I wish she well in pursuing it, and I like that idea of being a regional hospital. Because healthcare in many of the rural areas, hospitals are struggling, are already closed. And so, hope we can keep this one going.
Yes, sir.
We won't have any problem.
Commissioner Wilkins?
I was just going to say, it sounds like you all are doing slamming job, as the young folks say, and I do appreciate it, and I'm sure the citizens of Nash County appreciate it. I did want to ask, has there been any study or report done on, and this is not critical at all, of the waiting times in the ER?
Yes, ma'am. So Jason actually is the senior leader for the emergency department. We compare ourselves to not only national standards, but state standards and UNC standards. And so I'll ask Jason if he's got any specific data points that might be helpful.
And ma'am, I would need to get you the exact minutes, but as we compare to, again, our state partners and other like-sized hospitals, our team has been working with our providers, our physician providers and partners to decrease that time and to improve our patient experience. Again, if there's specific times, I can get you that. We will be working on another project over the fall months to improve kind of that throughput so that our consumers, our residents in this county and the surrounding areas will be able to be seen in a more efficient manner.
And I have heard responses from citizens saying they went and, gosh, I didn't have to wait that long, and it seemed like you all had a process, so they were pleased with it. I was just curious as to how long the average wait is, so that's
Right.
fine.
And I can get that for you. I think one of the nice things, too, is that we're actually starting to see more, we'd say, people out of our area, they're from the Greenville area, driving from Greenville to our ED because they can be seen quicker than they can waiting at ECU Health. So proud of the team, proud of the work they do. I'm proud of the physician commitment that they have to our hospital.
Well, thank you, and thank you for all you do.
Other comments?
I'd just like to thank y'all for what you've done, where you've come from, and where you are now, and commend you for where you're headed. Y'all have really changed things down there, and it's looking good. We appreciate you.
Thank you, Ms. Coleman.
Well, you did.
Let me get through the board. Commissioner Harrington, you were about to speak, I think.
Else. Which region do you receive the most referral, from outside our area?
Wow. Well, surprisingly, the Outer Banks Hospital has been one of the surprising larger referral hospitals. UNC Health Lenore is another hospital specifically around GI-related care. And then Mariah Parham in Henderson, North Carolina, has been a leading referral source for orthopedics.
Others that haven't spoke? Ms. Belfield?
Oh, I was just you mentioned about the staff and the employees being involved in the community. What are some of those ways in which they are been at the hospital?
Sure. So, well, certainly we participated in 30 different volunteer community events this past year, which includes everything from church groups to civic groups where they had either a community day and asked us to come out and participate. We work very closely with our federally qualified healthcare centers where we both volunteer and collaborate on services for mammograms as an example. And then our community paramedics are a group of 4 paramedics that see patients that have identified in the hospital as high risk for readmission, and we see them for 30 days and go out to their house and do everything from a home inspection to, if they ask, we look at their food pantry and talk to them about their food and what's healthy for them and what's not, and we also help them with medication assistance. And so we're talking about this year as we expand how we continue to bring primary care and additional services out. So Dorsey Tobias and I meet every other month with the Eastern North Carolina Ministerial Association Executive Board to talk about partnerships and how we can make sure that we continue to be a good partner with our communities.
That's good. Reason I followed up and asked that question, at my church, the Men Fellowship asked me to find out you could get a doctor, a staff member to come and talk to the men on men health issues.
Well, I might be able to help you out with that. So Kirby Slade will be reaching out to you, and I'll make sure that we are working with you if you need someone to come and speak to your men's group, sir.
Okay. Well, I'll be in touch.
All right.
We usually meet on our third Saturday morning with breakfast, so I'll be in touch with you.
Yes, sir. We'll be looking forward to hearing from you.
No other comments. On behalf of the whole board, I greatly appreciate y'all coming today, giving this report. I'm very pleased that we were able to work together, our board with your board, in helping you get to the point you're at on the tower, getting the new lease in place. I was interested to hear how you did your human resources and having somebody from outside coming in and evaluating that. That seems to be a very similar process that we are just finishing up as well. Did it 2 years ago. We did it on portions of our employees during this year's budget as well, because I think we all know that hadn't always been maybe, but our people are now by far our most important aspect of any organization, regardless of what the organization is or what they do. I do, Dr. Isley, want to share one thing with you. I recall about 4 years ago, I got a call from a good friend that's a retiree from Carolina Telephone, and we have many of them in our area. And he was very upset with our hospital, very upset with the emergency room, very upset with everything that went on, and he's a very vocal person, and it wasn't a good conversation. I think you and I talked about it a little bit. I wouldn't have given you the names, but this past week on Tuesday, the same person called me, and he had had a real severe emergency, almost passed away, I understand, went to UNC Hospital, and for 30 minutes he told me how perfect everything was, what was done right, how quick he got in the emergency room, how y'all evaluated him, how he had something that you couldn't handle. You sent him to another hospital, but he was brought back to our hospital and ended up staying about 30 days between that and rehab on our hospital grounds. But to me, it just shows, I think, the big change that has taken place out there under your leadership and the team that you put together. And I greatly appreciate that. And I also took note of what you said, that you had discussed it, but I never heard it affirmative that in addition to the tower, you would be building another medical building down in the Middlesex area.
Yes, sir.
Which is wonderful. We're glad to hear that. And you mentioned some changes possibly at Nashville, which means you may be repurposing some of that or got space left, I don't know. But you'll share that with us at the appropriate time. But to be looking at the whole county is greatly appreciated by this board, because we have individual parts that we represent, of course.
Well,
But with that said, thank you for being here today, and thank you for the great news that you bring, and anything we can do moving forward in helping your building process. I noticed it seemed to be a simple building, a conservative type building, which I always look at, but it was very attractive. First time I'd seen any renderings of it, but look forward to getting it done. And if
well,
we can
thank you
help
very
in any
much.
way.
Thank you to the commissioners for your support, and we are dedicated to the entire service area, sir. And Middlesex is growing, Nashville is growing. We've got to meet those needs as well. So thank you very much.
Thank y'all. Thank you for being here. All right, the next item on the agenda is item 5, is a presentation on Juneteenth recognition. I'll call on our Assistant County Manager, Tia Fuller, at this time. I didn't hesitate much then. I see you smiling, and I hope I got it right.
Close enough. Thank you. Thank you. Good
I'll keep
afternoon,
trying.
everyone. The celebration of Juneteenth is a new event in Nash County organized by our Engagement Committee. Formerly known as the Morale Committee, our group rebranded earlier this year to better reflect the needs and values of Nash County employees. ENGAGE is an acronym for Embrace New Energy, Generate Awareness, and Grow Employee Morale. We ask our employees to please consider joining the engagement committee so we can collectively improve Nash County's morale and culture. We would like to acknowledge that this Wednesday, June 19th, is Juneteenth. Juneteenth, also known as Emancipation Day, is celebrated annually on June 19th to honor the emancipation of enslaved African Americans in the United States. The Emancipation Proclamation, issued by Abraham Lincoln on January 1st, 1863, declared freedom for enslaved people in Confederate states. On June 19, 1865, nearly 2.5 years after President Lincoln's proclamation, Union troops arrived in Galveston Bay, Texas, with the news of freedom. More than 250,000 African Americans embraced their freedom, marking the beginning of Juneteenth, or Freedom Day. With the principles of self-determination, citizenship, and democracy igniting their hopes and dreams, the people of Texas clung to the promise of true liberty for all. The historical legacy of Juneteenth demonstrates the value of maintaining hope in uncertain times. This Wednesday, the Nash County Engagement Committee will host a Juneteenth celebration on the 3rd floor of the administration building. This event provides an opportunity for employees to come together, reflect, celebrate, and view a historical display. Employees are encouraged to wear Juneteenth colors of red, yellow, green, and black in recognition of this significant day. Cake and refreshments will be served. We are excited to celebrate this important day with our Nash County team and embrace the spirit of freedom and unity that Juneteenth symbolizes.
Thank you, ma'am.
Thank you.
Greatly done.
Any
Questions on this item from commissioners? We'll look forward to seeing you on Wednesday.
Thank you so much.
All right.
Next item is item number 6. It is our 2023 CDBG NR grant, and I'll call on Emily Moore at this time to make this presentation. Good afternoon, ma'am.
Good afternoon. All right, let's see. So Nash County received a Community Development Block Grant Neighborhood Revitalization, CDBG NR, award of $950,000 from the North Carolina Department of Commerce's Rural Economic Development Department with no matching funds. This is to rehabilitate deteriorated housing or replace dilapidated housing with new homes. Nash County sought proposals for grant administration services to assist the county in management of this project in compliance with all applicable requirements under the North Carolina CDBG NR program. The fee for grant administration services will be paid with CDBG NR funds. Grant administration services include standard tasks necessary for implementation of the project in conformance with CDBG compliance areas. Proposals were due by Thursday, May 23, 2024 at 11 a.m. We received 3 proposals. Each proposal was evaluated based on qualifications, competence, and reputation of the firm, prior CDBG experience, qualifications of actively involved staff, ability to address local needs, availability, and cost of services. The approved $950,000 project budget includes $95,000 for grant administration. After thoroughly evaluating all of the proposals, it appears that McDavid Associates has the capacity and experience among its Community Development Block Grant Project team to best assist Nash County with the implementation of this project in an effective and efficient manner. So the recommended action would be to award a grant administration services contract to McDavid Associates, and this action would be subject to review and approval of the documents by the county attorney and county manager.
Thank you, Emily. Any questions on this item from board members? Emily, can you share with us the other 2 people that provided a proposal?
Yes. The other 2 were the Adams Company, which is out of Warsaw, North Carolina, and Insight, which is out of Wilmington.
Thank you. If there are no questions, I'd entertain a motion for approval of this request.
Mr. Chairman, I make a motion that we award the grant administration services contract to McDavid and Associates, and the action subject to review and approval of the documents of the county attorney and county manager.
All right, have a motion on the floor. Is there a second to the motion?
Second.
Second by Commissioner Leggett. Questions on the motion? Seeing none, all in favor, let it be known by saying aye.
Aye.
Any objection by a like sign? Motion stands approved. Thank you,
Thank
ma'am.
you.
I failed to take care of one item at the beginning that I should have, and I want to do that now before I fail to do it again. There's come a need to have a closed session after this meeting, and it would be for a personnel matter as well as an attorney-client privilege item. I would not expect any action to be taken after that closed session, but I'd entertain a motion to alter the agenda to add the closed session at this time.
Mr. Chairman, I move that we accept that closed session at the end of this meeting.
All right, have a motion to approve the agenda change. Is there a second to that motion?
Second.
Second by Commissioner Combs. Questions on that motion? Properly done, Mr. Attorney. All in favor of the motion, let it be known by saying aye. Aye. Any opposed by a like sign? Motion stands, and we'll add that as item number 9. The next item is a few budget amendments we have here near the end of the year, and I'll call on Donna Wood at this time to make these requests. Good afternoon, ma'am.
Good afternoon. I have 4 budget amendments to present to the board for consideration for the current fiscal year 2024. The first item is a budget amendment to adjust funding available to ensure that retiree health insurance expenditures can be covered through the end of the fiscal year based on current projections. I'm requesting $45,000 from fund balance appropriation. We have 17 new pre-65 retirees during the current fiscal year, and our estimated budget wasn't enough to cover those, and this is to ensure that we can make our final payment at the end of the year for those retirees. With the water sewer fund, this is separate from the general fund. I'm asking for a $15,000 fund balance appropriation, $10,000 to cover part-time salaries, and $5,000 to cover our retiree health. And again, we had an employee from our water and sewer division to retire during the year that we did not fully estimate the cost of the retiree insurance, and so I'm requesting $5,000 to cover that through the end of the fiscal year. The next item is with EMS. This budget amendment is to adjust the lease expenditure and other financing source budget to properly record the cardiac defibrillator lease. I have to record that in full, and I need to add $45,000 to that. It's offset with other financing sources and the lease expenditure for accounting purposes. And the final item I have is with the solid waste fund. And this is a request for fund balance appropriation for $83,000 to purchase a tractor. The tractor at the landfill, I think the engine just died, and we actually have to have one out there. This is a state contract price, so I'm asking that we could go ahead and get this purchase order in place, get the funds budgeted, and get a purchase order in place to get this replaced.
Any questions of these 4 budget amendments from commissioners? Seeing none, I entertain a motion for approval.
Move for approval.
Moved by Commissioner Outlaw. Is there a second?
Second.
Second by Commissioner Wilkins or Leggett. Which one?
Leggett.
Leggett, I'm sorry. Any questions on the motion? All in favor of the motion, let it be known by saying aye.
Aye.
Any opposed by a like sign? Motion carries as well.
Thank you.
Ma'am. That get your books in order for the year? Thank you. All right, the next item on the agenda is the fiscal year 2025 budget ordinance, and I'll call on our manager at this time to make this presentation.
Thank you, and good afternoon.
Good evening, ma'am.
You have the annual budget ordinance in front of you. The actual ordinance is only about 6 pages, and then you've got the full fee schedule attached to that, so that's why you've got such a thick packet there in front of you. I will say that staff have been working on this budget up until today, so Mr. Boone was continuing to work through the weekend to finalize the salaries in our emergency services department and getting those figures into the system. So I will say that although the bottom line budget number has not changed at all, there is some slight differences between the governmental budget and the public safety budget. I think both by about $100,000 if you compare these figures with the previous draft ordinance that was provided to you. Because we did have some changes, I will ask Jonathan Boone to make some comments to the board. You have a couple of spreadsheets in front of you that have data on them for the salaries. And do you want to stay there or come up here? Okay.
Good afternoon.
Good evening.
Afternoon.
So as the manager indicated, I passed out some copies of 311 by 17 sheets, and I'll be glad to answer any questions you may have about the data that you have there. But a couple of things I did want to highlight that have been revised from the previous presentation and the numbers that were included in the recommended budget that the manager referred to earlier. We made some additional changes in emergency services, just want to highlight those. So if you actually go to the third sheet of the three that you have, so the first sheet is kind of a sheet that gives you an opportunity to kind of compare positions between the sheriff's office and emergency services and where they fall in the pay scale. And just want to remind you that the sheriff's office uses a rank and pay system. So any employee, regardless of years of service, is paid at the same rate. So you'll see that on that sheet. That applies to both sworn and non-sworn. And emergency service, on the other hand, is a job paying class, which most of the organization is paying class. So that's on the first sheet. The second sheet, folks, is just on the sheriff's office. Third sheet, just on emergency services. And what I wanted to share with you there, the changes, again, from the previous submittal of the budget, the recommended budget to where we are today, and what is included in the ordinance that you will be considering today. We made an additional change. Telecommunicators, you will see at the in the top table shows the existing pay range, and then you see to the right is the proposed pay range with the pay study, and again what's in the budget. And you'll see telecommunicators currently assigned to pay grade 109, and that plus there, just to help you make sense of my hieroglyphics, lets you know that that pay grade has changed, and that pay grade was changed to pay grade 110. And basically between each pay grade is a 5% adjustment. That's how our pay scale works with our pay and class position. So telecommunicators were adjusted from pay grade 109 to 110, and paramedics, which are currently assigned to pay grade 113, which is in the bottom. I've got these kind of broken into divisions, so hopefully you can follow that. So we go to the bottom of the page, we're focused on positions in EMS. You'll see paramedics currently are assigned to pay grade 113. The pay study had recommended reassigning paramedics to 114, and in the budget ordinance you have in front of you today, we have paramedics assigned to pay grade 115. So instead of a one pay grade adjustment, it's a two pay grade adjustment. And then we made a few other minor changes, but those are the most significant changes between where we were when we submitted the recommended budget and where we are today with the budget ordinance that you have. But with that said, I'll be glad to answer any other questions that you may have regarding the data in front of you. And I feel like you've got a question, Commissioner Wilkins.
I've got a question.
Any question by Commissioner Wilkins? Go ahead.
For the sake of those listening and us up here, and for the record, they don't know what the grades are, what's being paid. Would you give the starting salary for telecommunicators and EMS and starting salary for deputies? Okay.
So for the deputies will be easy. I just want to qualify my answer when I give you a number for emergency services as no for the two positions that you just asked me for. They work 24/72 schedules. There has scheduled overtime and scheduled in-service training. So the starting salary will not necessarily account for those additional hours.
Okay.
So the actual anticipated annual compensation will be higher than the number I'm going to give you. But again, just wanted to qualify that. And I've actually got a sheet, and I could give you an example for the paramedic, and I think I will, just for clarity. But for deputy, current starting salary for deputy is both on the first sheet and the second sheet. But if you look at the first sheet, at the top of the spreadsheet, you see deputy, currently pay grade 200, starting salary is $45,925. And again, that's day one on the job, or if you've been a deputy for 5 years or 10 years. All the deputies, that's rank and pay, there's one salary for that position. And if the budget ordinance is approved today, effective July 1st, the starting salary for a deputy will be $54,894. So I'm going to assume the next question you're going to ask me, which could put me in trouble, but I'm going to make the assumption anyway, is that results in an increase of 19.5%, and that does account for the cost of living adjustment that is included in the budget.
Yeah, and I mean, I understood the sheet, but I want the public and those listening or sitting out here to know, to have an amount. So, yeah, so deputies will start at 54,894.
54,894, yes, ma'am,
Okay.
that's correct.
Okay.
The other positions I think you asked me about were telecommunicators. Well, I guess if we're talking about telecommunicators, I misspoke. They're not on 24/72 schedule. But telecommunicators, second sheet, you can say they're currently assigned to pay grade 109. Starting salary is $39,828. And again, budget approved, effective July 1st. Starting salary for a telecommunicator will be $43,074. I did not do the math on that one, I'm sorry, but I could do it right quick if you need me to.
I'm good.
Paramedics, so again, paramedics currently assigned to pay grade 113. You can see that at that second table on page 2, so they're at the bottom. And this is where, again, this salary does not, the starting salary I'm going to give you does not account for the scheduled overtime and in-service training, but I've got a number to follow up with you on that. But starting salary, $48,411, and effective July 1st, if the budget is approved, that starting salary, that number will be $54,975. But if we take that number and one change, and I've noted it on the form, we currently determine hourly rate by taking that salary and divide it by 2,184 hours. That accounts for their regular 1,872 hours and 312 hours of scheduled overtime. So if we take the existing number and we take the proposed number beginning July 1, the annual compensation, and that assumes no additional unscheduled overtime is worked, so just that scheduled overtime. So for a paramedic on day one, first-year paramedic, with that beginning salary number, the annual compensation with the regular hours and scheduled overtime would be $51,879. And with the reassignment to pay grade 15, working those same hours, and now determining the hourly rate by dividing by 2080 instead of 2184, that annual compensation would be $62,903. So that is an increase of 21.2%.
And would you just point out the detention officers? I mean, I can see it, but I just want them to hear it. The starting salary for detention officers.
Detention officer.
Mr. Boone, if I could, Mr. Wilkins, before you leave those numbers, would you say them one more time on the paramedics? I got most of it down, but I didn't get all of it down.
So with 1,872 regular hours, 312 overtime hours, and actually 40 hours of in-service training is the assumption.
Mm-hmm.
Annual compensation will be computed to be $51,879. And effective July 1st, that number would become $62,903.
Or a 21.3% increase.
Correct. And again, that does take into account cost of living adjustment.
Right. Mm-hmm.
But pay ranges, as we discussed when we discussed the study previously, Existing employees, cost of living 5%, and proposal is the pay ranges would be adjusted 3%. That helps us address compression moving forward.
I understand
So
that.
it's really factoring 3% into the pay ranges.
Right.
You asked about detention officer.
Before we move on, that $62,983 number for the paramedics, is that for a minimum, midpoint, or maximum salary?
Minimum.
Okay.
Yeah, that's your minimum starting new employee.
Detention officer, current minimum salary, they're assigned to pay grade 300, again, rank and pay. Beginning salary is $42,176. And with the pay study and the 3% adjustment to the pay ranges due to cost of living, that minimum salary becomes $47,354, and that is an increase of 12.3%.
And that's the starting rate.
That is correct.
Thank you.
Commissioner Cole?
And I believe you said instead of figuring overtime based on 2,194 hours, you're now using 2,080, is that right?
2184, now we're using 2080.
Okay, that's, okay, 2,184. Now you're using 2,000.
Effectively, that is,
That'll make,
that's 5%.
that'll make quite a difference. Yep.
Jonathan, did you just say 3%?
3% to the ranges for, thank you for the, so for, again, if we got a foot in each world with rank and pay and pay and class. So pay and class ranges are adjusted 3%. Rank and pay ranges are adjusted 5% because they do not have a minimum, midpoint, and maximum. So compression is not an issue because every employee with a certain job title gets paid the exact same rate. So let me clarify that. So rank and pay, those ranges account for a 5% cost of living. They do not have a minimum, a midpoint, and a maximum. The reason we use that differential of 3% and 5% is to deal with compression. Compression is not an issue, and well, depending on your perspective, it's not an issue in the rank and pay because every employee, every deputy sheriff is paid the same rate.
Why is the sheriff's pay different? Hey, why is the figure different?
The sheriff requested that, change during the last pay study.
Okay.
It's also noted, Jonathan, on the deputies, we have 3 classes of deputies.
Correct. We have a career ladder for deputies.
Right, we have deputies, senior deputies, and master deputies. But we've all heard this $60,000 starting pay figure from everywhere in the world. And basically, if you use the word deputies, including all deputies, the starting pay average for a deputy now is $60,616. So I think, in my own mind, we've come a long way because of the deputy itself. I'm assuming that a senior deputy could come from somewhere else with the experience and start as a senior deputy. I don't know that to be true, but I would think you could. So the average starting pay for all of our deputies, if you look at all 3 classes, is the $60,616.
Right.
Which is worth keeping in your mind, I think. Excuse me for interrupting you, sir.
No problem. Any other questions?
Questions?
Just one comment, just to make sure it's clarified to the general public. I'm pretty sure I understand it, but if you look at deputies, you said as an incoming deputy, whether you have 1 day or 10 years, that's where you start.
Correct. That's how rank and pay works.
Under rank and pay, which is something that's different from EMS. So under the 25 proposed salary table, which I feel comfortable we'll approve today, $54,894 would be your starting.
Correct.
1 day, 10 years.
Correct.
Okay, if you go over to EMS and you look at paramedic for, as an example, 115, the minimum 25 is 54, almost 55,000. But it's a pay and class system, so it's at the discretion of the hirer to determine what experience that person brings to the table. So they could come in at midpoint or upper range. Would that be a fair statement?
The manager has some flexibility if the department head requests a salary other than the minimum that would recognize experience in another agency up to 10%, and beyond that, we would have to come to the board for their approval. But we do have some flexibility in that regard.
The upper range on 115 paramedic is 88,531.
Correct.
Okay. And I agree with what the chairman said. If you total up the total positions under deputy, and you look at the average of all those positions against the 25 salary schedule, then it does average over 60,000, but a master deputy, 66,203, and I assume that the sheriff could promote from within his own ranks from deputy to senior to master. That would be at his discretion, and I'm sure he's got a system. He's mentioned to us on how he handles that.
Correct. He does have criteria that he uses for those
That's right.
career ladder positions. And the only thing I would say, certainly there's a potential for that employee that may be a deputy, they have 10 years of service, they could have availed themselves to the career ladder. So a senior or master, which you referenced earlier.
They could, but they could also have 10 years of service and
As
be
a
at an
deputy.
incoming salary as a deputy with 1 day.
Yes, sir, that is correct.
Okay.
I've got a question. When the manager made her opening comments, she mentioned that there was a $100,000 difference in the pay from when this was previously introduced or discussed and now. Is that a $100,000 difference up or down?
That is $100,000 out of the cost of the pay study. And part of this is a process, as we've gone through various iterations of the pay study, the estimates we've had to use, the one we actually got down to final numbers, and then working with our finance office to put it in a spreadsheet to finalize the numbers for the ordinance, there was a slight difference in the numbers, but we're talking about payroll between two departments, that's $30 million.
Right, okay. All right, and then my other question is, at some of our different budget meetings, and we were presented with different budget numbers for the sheriff and his department's pay. One was using a county comparison, and one was using a city and county comparison. What is the major difference between that and these numbers that we've got in front of us?
I'm sure I've got some of those numbers with me. But first, I just want to confirm that the numbers that I have shared with you today are based on the county data, not on the blended data, which included some towns and municipalities. I have some examples in the sheriff's office because it primarily impacted the sheriff's office because emergency services, pretty much counties are the only ones in that business, other than maybe towns and cities that may have telecommunicators. But again, I'll give you an example for a deputy, since we've already talked about deputy today. The pay rate I shared with you, the fiscal year 25, so the upcoming budget, 54894. With the blended data, that number would have been 55939. So rough numbers, 1,000 and I think less than $1,010. But that would have been the difference if we'd used the blended data, but we elected to use the county-only data from the 8 counties that we included in our study.
Did you all run the numbers on what it would cost to use the blended number?
We had some estimated numbers, but we did not go to the level of detail that we went to bring the numbers to you today.
Right.
I do not have that number with me today, but
Okay.
certainly I can get you that estimate.
That'd be great.
Other comments or questions from commissioners? Commissioner Wilson?
I was waiting to see if anyone else
Sure,
had
you good?
anything before I went. So, and another clarification for the public, I just want to bring attention to the sergeant detective salary or the percent adjustment and the chief deputy percent adjustment, which is 0% according to the salary study, and that is because I understand their salary is already at the level, going by the county-only data. They are already where the study says they should be. So there was no extra percent increase, but the 5% COLA if we vote on that.
Correct. So our current averages were higher than the county data that we collected, the average of that data. So we did not adjust those salaries downward to meet the market average. We left them where they were, and then moving forward, all we added was the cost of living.
And I just want to say that's a good thing because, and Chairman stop me if, or Mike stop me if I shouldn't, but the chief deputy salary, the study showed minus 4%. So in other words, it was recommending a minus 4% for what he was already making. And just for the public, we are not taking from anyone.
Right.
From any employee, not the chief deputy, where the study said recommended minus 4% off the salary he was already getting, but instead, he would still get the 5%. So I just wanted the public and the citizens to know that.
Yes, ma'am, good catch.
Thank you, Mr. Boone.
Thank you.
So I'll pick back up here with this item unless there's any additional questions that the board may have.
You would take back, say that again?
I'll pick back up with this item to present this item to you for the vote unless there were any additional questions.
I think we've got a question now.
Okay, very good. So on May 20th, 2024, the original budget message was presented to the board. On June 3rd, 2024, the board's regular monthly meeting, I provided a summary of the original budget message, and the board held a public hearing on the budget. The final budget for consideration today has all of the items presented to you at the June 3rd, 2024 public hearing. The total general fund budget for fiscal year 2025 is $125,469,132, and the overall budget, which includes the general fund, enterprise funds, special revenue funds, and the internal service funds, is $142,937,213. And at this time, it is recommended that the board adopt the 2025 budget ordinance.
All right, then, no other questions. I'd entertain a motion to adopt the budget as presented by the manager.
Mr. Chairman, I recommend that we adopt the budget for fiscal year 2025, as presented.
All right, have a motion on the floor to adopt the budget as presented. Is there a second to that motion?
Second.
Second by Commissioner Combs. Any questions on the motion? All in favor of the motion, let it be known by saying aye.
Aye.
Any opposed by a like sign?
Aye.
Motion carries on a 6-1 vote, if I understood it right, correct? Thank you.
Thank you.
All right, the last item on the agenda is the item for closed session, and I would entertain a motion to go into closed session at this time.
So moved.
Motion made by Commissioner Wilkins to go into closed session. Is there a second to that motion?
Second.
Second by Commissioner Harrington, Commissioner Leggett at the same time. Any questions on the motion? All in favor of the motion, let it be known by saying aye.
Aye.
Any opposed by a like sign? Motion carries, and we'll take about a 5-minute recess and then begin in closed session. Thank you.